think mental health awareness has grown by leaps and bounds in the last even 5 years. At the time that the campfire happened, after that, there were individuals in the community who would contact me to say, thank you for your research, but my healthcare provider doesn't quite recognize my symptoms as being driven by this disaster that I underwent. So the healthcare community, the mental health care community really needs to understand that these disasters can have a long-lasting impacts on our mental health. And what I want to highlight there is the long-term focus. After the smoke subsides and the fires are gone a week out from now, the mental health impacts can still be long lasting. They can continue from the acute stage to the chronic stage, which can be very worrisome. That's what we need to prevent, but that still continues in about 40% of the community. When we sampled the campfire, this was almost a year out after the fires had burned, and still that many members of the community who were showing those symptoms. So these are long-lasting effects. One of the ways of really starting out at efficacious treatment is to first acknowledge what the patient has gone through and to acknowledge that a disaster such as this can have long-term mental health impacts, including long-term cognitive impacts. So even if you're not suffering from low mood, we see significant impacts on attention and decision making that I was telling you about before. And you may not be able to hold up your daily routine activities, your work life, the things that you need to do on a day-to-day basis to get through your work day and so on. And people are having these symptoms a year out, and they sometimes don't even connect it to the disaster that they went through. But this is happening in the community at large. So acknowledging these symptoms is very important for our mental health care support providers. I also want our providers to recognize that this is a time for not just compassion for our patients, but also oneself. The providers that are helping out the community are the ones who are really in the thick of it. They are in that LA region and potentially looking at pro bono support for their community. But really also please take the time to take care of yourself and your own mental health and practice self-compassion. Take a break. This is impacting every community member, including our first responders, our firefighters, our social workers who are in the field. So it's very important that we keep in mind that we need to take care of ourselves as well.
Are there specific tests or types of questions you're asking individuals, or you encourage clinicians to be asking individuals as they're kind of doing like an intake assessment?
I think one can definitely take the lived experience as the gold standard. So not to ignore when a patient talks about symptoms of inattention, of being highly distracted, of not being able to make important decisions, especially when it comes to recovery efforts. There's so many choices how to make the best path towards recovery that also is within the means of the individual. These are important questions. And how to make these questions when one is literally suffering from a phenomena that we now call the fire brain, this hyper-aroused, hyper-threatened brain. We find that the neuroscientific research shows that essentially when one is impacted by such a disaster, our brains go into this hyper alert mode, especially our frontal cortex that is helping to execute all of our cognitive behaviors. And this is really interpreted as the brain being in threat mode, that it's overworking, it's in overdrive to think that everything in our environment is unsafe, is threatening, especially to our survival, and therefore I must pay attention to it. Even when it's not the case anymore, even when the disaster has surpassed, one's brain is wired to think that way. which is something that needs to be corrected. And it can calm down with therapies. It's just that one needs to acknowledge that this happens. And when you say, again, diagnostics, one can obviously, ask questions around ADHD, and you'd see those symptoms. And of course, ADHD is a neurodevelopmental disorder. It's not that the person's developing ADHD at that point in time. It's just those symptoms are manifest because of the trauma that they've undergone. And so taking the lived experience as standard is important. In our research, we do standard cognitive tests that are objective measures of cognition. They're not asking questions around your attention status, but they're actually doing a test where they have to pay attention to certain things while other stimuli on the screen are distractions. And then we are able to measure how distracted they are. And then in other tasks, they're making decisions, actual decisions, and then we see how well they're making decisions that are basically bringing them long-term gains or versus impulsive decisions. So one can do objective tests. I would say this is not required in the clinic in any way. Please take the lived experience as the standard and take that seriously. Yeah.
Thank you so much for listening to this episode of the Delgado Podcast. As always, you can get the show notes, video links, and resources mentioned in this episode on my blog at mikedelgado.org. You can also get updates to new shows and get access to the full archive of past shows by following the Delgado Podcast on YouTube, Instagram, Twitter, and TikTok. And if you ever have suggestions for future topics or guests you want to hear from on this show, please reach out. My email is delgado@ucla.edu. Thank you so much for listening, and we'll chat more next time.